So we're on to, I believe, the final award of the evening, the Pillay Antimicrobial Stewardship Memorial Award. As many of you know, Daz was a pivotal part of the fight against AMR as part of his work across the heart of England and with his colleagues across in Birmingham. And he had been at our awards actually previously, not long before he passed away, and he made an impression on myself, all only because of his shoes and his style. And I remember striking up a conversation with him and seeing his enthusiasm and passion for AMR and for supporting his colleagues and working collaboratively. And since then, his widow, Tilly, has continued to support and champion his work and his legacy by providing some funding towards the actual winners support moving forward for training education, which this is about. Diane touched on it before about students and younger people. What Pillay Memorial Award is about is advancing and supporting those who are looking to combat this on both an international and a national stage. And Daz was one person amongst others who wanted to support people on his team, and he's spoken so highly about by colleagues. So it is always an emotional category award, and we do remember Daz this evening and think of his family and his children at this time. So the shortlist for this category is Aaron Brady from the Belfast Health and Social Care Trust, Balram Ratish from the Aster MedCity Kochi in India, B. Yannig, which is from Buckinghamshire Healthcare NHS Trust, and I've heard from already, Wendy Thompson from the University of Leeds. And the winner for the, highly commended, should I say, for the Pillay is Balram Ratish of Aster MedCity in Kochi, India. Dr. Ratish has been involved with this hospital's antimicrobial stewardship program from its initial stages and was instrumental in its initiation. He has worked with the stewardship team and conducted multiple quality improvement projects. He has been able to demonstrate a positive impact on antibiotic consumption and clinical outcomes. Judges' comments include they firmly believe that there is no better candidate than Dr. Ratish, who has demonstrated passion and results in quality improvement in the field of antimicrobial stewardship. Fantastic. Are you there, Dr. Ratish, to join us this evening?
Hello, good evening.
Good evening, Doctor. Congratulations.
Thank you.
Tell us a little bit about some of the work you've been doing.
Yeah, I apologize for appearing sleepy because it's past 2 a.m. here in India.
Thank you for being up and joining us at that time. That's dedication and just demonstrates your passion for this. Tell us a little bit about what you've been doing.
So I've concentrated mainly on a quality improvement model with respect to antimicrobial stewardship. It started off in my hospital where during my training in internal medicine, and I was particularly interested in infectious diseases. So it started off there, but from there we were able to, as a team, we were able to expand it to all our sister centers spread out all over South India. And now currently, because of the COVID pandemic, we are taking it a bit slow, but we have plans to expand it to other places in India and abroad, because we have a number of sister centers which is there in other countries as well. So that's
fantastic.
The plan.
Fantastic. And have you found the collaboration amongst your colleagues being helpful moving forward, this project?
Oh yeah. None of this would have been possible without the wonderful team who has made this possible. You can see them in the collage. They are the backbone of the entire project. I was just along for the ride for the most part, even though I did help with the implementation into the other centers. Yeah.
Fantastic, brilliant. Well, thank you very much for taking the time
in
the middle of the evening to get up, middle of the night, should I say, to get up and be with us. But I appreciate that, and it just demonstrates the support that there is for AMR across the world and the international collaboration that Dan spoke about. So good luck with the rest of the project and congratulations as well. Right, on to our winner of the Pillay Antimicrobial Stewardship Memorial Award for 2020 is B. Yin Nig. B was commended for her work with the Commonwealth Partnership for Antimicrobial Stewardship project together with Nottingham, Trent and Makerere universities with the aim of strengthening antimicrobial stewardship in Wakiso district, Uganda. I feel that I've gained so much more than I've given. After this experience, we have changed the way we deliver teaching sessions, and that was from B herself. Have you managed to sort that out, B?
Hi, I work with B. I'm a colleague, and B works at Buckinghamshire Healthcare Trust with me as an antimicrobial pharmacist. And I have been absolutely taken back by B's enthusiasm and commitment to this Commonwealth Partnership for Antimicrobial Stewardship project. She isn't always the most confident person, but she flew over to Uganda hoping to contribute to some educational workshops following a scoping visit in April, and she was fabulous. She worked so hard with the team to make sure that the content was relevant to the setting, listened to feedback, changed things up until I think midnight, and just worked so well and collaboratively with our fellow pharmacists, environmental scientists, public health lecturers, everybody in the team. B has worked so hard, and she's a real inspiration, and I hope that a lot of other people look and see what she's done and think, yes, I can do that too. So thank you, B.
Well, lovely words, Claire. Thank you very much for taking the time to speak. And sorry about that, B, with the line, but I think Claire's encapsulated it better than anything really, and shows how deserving you are of this award. So congratulations, and have a good evening. And once again, thank you for entering. Thank you, Claire.